The University of Nairobi, as part of a global community, aims to have holistic staff by prioritizing the mental health of its workforce. Unsuccessful, fragile, and productive. Those are some of the thoughts people with anxiety, bipolar disorder, depression, and PTSD grapple with. It can be extremely exhausting when you find yourself at war with your sanity, especially at the workplace.
Mental health at the workplace is key and very important in terms of just understanding client dynamics, employee dynamics, and just being in a position where we can support staff be productive and give their best at their places of work. Basically, it's coming in because apart from work, probably they're coming with baggage from home, and so wellness will give the professionals a chance to be able to assess for stress and other mental aspects and provide a supportive platform to be able to support employees to deal and cope with mental disorders.
Charity begins at home, and so does the mental status of employees. It thus goes without saying that work associated with mental health conditions often stem from childhood trauma, toxic partners, toxic friends, and at times even fears.
We will do an assessment, a psychological assessment, to find out. And most of the time you find these people are suffering from stressors, which could be life, just general life stressors. Sometimes they're coming from home, sometimes from the workplace, sometimes they have even mental illness. So we have a psychiatric clinic, we'll refer them where they get the right help. If they need admission, they're admitted, the university takes care of that. And then it supports the staff to come back and the students to come back to mainstream and be productive members of the society.
Ensuring that your mental health is on the right track is key. It can, however, prove costly, hence making it hard for individuals to seek medical support.
As it currently is, because mental health is just coming into the country, it also means that the medicines are also expensive. So psychiatrists don't charge what they charge because they just want to be expensive. It's because it actually costs a lot of money. Number two is the profession is still growing. So people who've made it up there, they cost a lot because it also costs them a lot to learn. So it's just a matter of value. The higher the price, the more value you're likely to receive. However, that's just dependent on, it's not a case study for everyone. So there are affordable places and saving towards them is one great way of doing it. Yeah.
Finding social support teams among people with mental conditions serve reminders that living with a mental illness is not a recipe for failure. Moreover, such zoning is set for people to open up about living with a mental illness and to allow themselves to be identified beyond having mental illness.
Easy, I guess, is subjective because it depends on the patient, but I think people just need to know that it's there and it's possible. We have mental health services being provided for as low as 500 bob to all the way till like 4,000. So it's available in public hospitals, Oasis, all these other mental health hospitals. It's there. It's easy. It's just that people's minds haven't gotten to that they're like, I can actually go, or like, I'm not that sick, like I'm not doing so badly, like I'm okay. That's the problem. It's the mentality, it's not accessibility of it.
Accepting that there will be obstacles to mental stability might sound hard, but delaying the journey often makes things harder than they should be.